is Fanio Ayolua Priest, a student of Healthcare Management/Nursing of the Joint Professional Training and Support Institute of Science, Management and Technology, in collaboration with South American University (USC), Global West University Togo, Pan American College, California. I'm here to defend my term paper titled The Effect of Doctor and Nurse Relationship on Patient Care. The effect of doctor and nurse relationship on patient care will bring two things. Is either it brings strain and stress on the patient's health, or it brings ease and health recovery of the patient's health. Effective nurse-patient relationship is imperative in nursing care, since this makes the patient feel at home and feel at ease in and out of their stays in the hospital. It symbolizes agreement between the nurses and the patient to work together for the good of the patient. For a nurse-patient relationship to be therapeutic, there must be good communication between nurses and patients. This good communication will make the difference between average and excellent nursing care. The purpose of this therapeutic relationship is to support the patient, to promote healing, and to support or enhance functioning. The relationship that exists between nurses and patients is very important because it can either put a strain and stress on patients or ease their pain and make them to recover quickly. The nurses are obliged to establish and maintain effective relationship by using their nursing knowledge and skills, while they apply caring attitude and behaviors to the patient. The attitude that they show to the patient will determine the rate of the patient's recovery. Either it will ease or it will fast track their health recovery. The types of relationship that exist: intimate relationship. This is when the nurses and the patient are so close in order to feel the pains of the patient. Also, social relationship. The social relationship is whereby the patient and the nurse collaborate together. Then therapeutic relationship, which shows the good communication between the nurses and the patient. The effect of nurse relationship can either be in two ways, either positive or negative. The positive nurse-patient relationship, it increases the patient's recovery rate. It makes the recovery of the patient to be fast-tracked. 2. Positive relationship between nurses and patients. It enhances patient's sense of safety. The patient will feel safe in the hands of the nurses and the doctor, and the patient will feel protected. 3. It improves the levels of patient satisfaction. The patient will be satisfied with the health management, with the health care that he or she is being given. And also it enhances greater adherence to treatment. The negative nursing relationship between patient and doctor can kill patient slowly. When there is no good relationship between the doctor and the nurses with the patient, the patient will be dying slowly. It will not be the death of the illness, but it will be the death of the attitude of the doctor and nurses to the patient. Also, negative relationship increases the emotional, physical, and psychological state of the patient. Is either it will bring depression, stress, and anxiety on the patient. So, a good relationship between doctor and nurses on patient care, it makes recovery, it fast tracks the recovery of the patient. But a negative one brings slow death on the patient, it brings depression, it brings anxiety, it brings stress on the patient. So I recommend a good relationship between a nurse, doctor, and the patient. Thank you.